Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about returning to golf after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So returning to golf after knee replacement is a very reasonable goal. There's many people who, after knee replacement surgery, will return to golfing and playing golf. Now, a couple things to keep in mind is we definitely want to ease back into it. We don't want to just go from a few weeks out from surgery and then just go play 18 holes of golf, walking the whole course. The first thing you definitely want to do is double check with your surgeon, double check with your physical therapist, just that if they have any concerns or any reason why they want you to not play golf or want you to wait a little bit before returning to playing, just double check with them is a very good idea. Now, there's really no set time frame, but typically you want to wait about 12 weeks or 3 months out from your knee replacement. This just allows your body some time to get your range of motion in a good space, to get your strength progressing appropriately and getting some return of muscle strength, and just improving your overall symptoms and your mobility to tolerate returning to golf and being okay and feeling okay. And like I said before, we really want to ease back into it. So for example, you may start by going to the putting green. You may start by going to the putting green and then doing a little bit at the driving range and just playing at the driving range, hit a bucket of balls and see how you feel. From there, you may do a little bit of chipping, things like that. And you may want to do that a couple of times, not just do one round at the driving range and say, okay, I feel good, I'm good to go. Maybe do a couple rounds of, again, the putting green, driving range, trying all the different shots, seeing how it feels. Feels okay, then let's go ahead and try playing a round of golf. Now, understand that after having a knee replacement, your swing is probably going to be a little different because of the mobility, because of pain, stiffness, whatever it may be. You may have some differences in your swing compared to what it was before surgery. If you're someone who has this resource, definitely consulting with a coach, a swing coach, may be a good idea. If you don't have that resource available, talk to your physical therapist. There's a lot out there that have some decent understanding of golf and swing mechanics and things. You can definitely look stuff up online just to get some tips and some feedback. And then again, just, do some self-assessment at the driving range before going out onto the course, just to make sure everything's comfortable, everything looks okay. As you are playing, you really want to start with about 75%, 80% intensity of your swings and how hard you're swinging and all that good stuff. Start about 75, 80% and build up back to, full all-out swinging with your drives and with your irons and things like that. Now, when you actually do get back out onto the golf course, some helpful things is, 1, start with 9 holes. Don't start with 18 holes right away. Start with 9 holes. If you can, use a golf cart. Again, ease back into walking. There's a lot of people who will return to golf and they'll say, oh, my, swinging the golf club and doing all, the actual golf part wasn't a big deal. Is walking the whole course, doing all that walking on the golf course, and it's, uneven surfaces, divots and up and down. So ease back into the walking aspect. In the long term, doing that walking can be really, really great for your health and your well-being, but just again, ease back into it. And then after you play a round of golf, see how your body responds. Do you have significant increased pain, increased swelling, stiffness, discomfort? It may be a little too much, or you may have to take a prolonged amount of rest before getting back and trying another round. Listen to how your body responds. If it feels good, you can continue, try a little bit more, or do another round of 9. If it's really achy, painful, stiffness, whatever that may be, all right, maybe I have to ease off, maybe I have to go back to the driving range a little bit, maybe I have to take a little bit extra time off before I try again. Things like that. You're going to have to guess and check, use your best judgment, use some logic as well. And just think about your body as a whole as you get back to golfing and get back to any activity after knee replacement. Think about, how does my spine feel? Do I have good mobility in my spine? Do I have good stability and good core strength? Do I have good mobility in my hips to help me swing the ball effectively? Don't just get tunnel vision and focus on your knee itself. Think about your body as a whole. Think about how it's moving, where you have strength, where you may not have adequate strength, where you may not have adequate mobility in your hips or your spine, your shoulders. And just think of your body as a whole is my other recommendation. So I hope this gave you some helpful tips and advice for getting back to golfing after surgery. Be sure to hit that like button if you found this helpful, as that helps me spread this video to others. Again, hit that subscribe button as well if you haven't already. And of course, leave your comments and your questions below, and I'll get back to you. Thank you for watching.